Doctor, I heard that you have recently started a new treatment wherein you take a few hairs from here, process it, take out some cells from there and inject it here. Does it work? Is it safe? Please tell us. So I am facing these questions recently from patients. The answer is yes. And to explain about those treatments, I am here, Dr. Venkatram Mysore, dermatologist and hair transplant surgeon, Venkat Center for Skin, ENT and Plastic Surgery, Regenera, Banashankari, Cunningham Road, Bengaluru. We are doing such a treatment now and I am going to tell you about it. This is a treatment called hair follicle derived cell and growth factor treatment or scalp micrografts. Now, this was published in a research paper in 2019 by an Italian group of workers using a machine called Regenera. This machine had been used to take out extract and to inject into joints for joint pains, osteoarthritis. And they extended it into hair. They called it scalp micrograft treatment. But the machine was expensive, consumables were expensive, and the machine, while doctors did it, it didn't really take off in a big way. This year in 2019, a group of workers, doctors from multiple countries and from India also, they published a paper saying that this treatment works and there is a growth of nearly 28% of hairs at the end of 1 year with just one injection. We have been doing this for the last 2 years silently without any publicity, and we found that the patients were quite happy and hair growth could be seen. And so now we are doing it on a regular basis. What is this treatment? Now, you all know that the hairs in this area are permanent hairs. They don't fall. That is why we take them during transplantation. They have certain cells called progenitor cells which are absent here in this part of the scalp. Now look at this diagram. This shows how a hair grows. There are stem cells at the lower part called bulb, at the middle part called bulge. These stem cells go through different stages. Stem cells become progenitor cells and then they start multiplying into typical hair cells. In this part of the scalp, the progenitor cells are absent. They are present here. This method helps us to break down the hair follicle to get an extract which contains those progenitor cells and also certain other growth factors which are present in the hair. And in our center, what do? We mix it with PRP, which contains various growth factors. Then we inject it into the scalp in this area. And this is a single injection which can work up to 6 months to 12 months as per the recent evidence. So it has certain advantages over PRP, which is also a similar treatment. In PRP, you take growth factors from the blood. Here you are taking it from the hair. PRP has to be done once in a month for 4 months, whereas this can be done just once. Now the advantages of this method are, it is done less frequently, once in 6 months or a year. In our center, what we do, it includes PRP also. So it is useful in certain special situations. Number one, we get patients from abroad. They are here for a week or 15 days. They cannot take PRP once in a month for 4 months. And PRP is very expensive in those countries. So this treatment, being just one treatment, is very useful for them. The second situation is, in some people, PRP has to be done a monthly. It has multiple injections. Some people are apprehensive about getting those injections every month. So in them, injection is only once with this new treatment. So they are suitable for this. A third situation, some people don't respond to PRP. Then we have to try something else. And there again, this treatment is useful. A fourth situation is, there is a situation called diffuse hair loss, where hair loss is everywhere and they are not suitable for surgery at all. And in them, if they are not willing to take drugs, particularly finasteride, we have to depend upon such regenerative treatment. So that again is a suitable patient population. Now, how is it done? We take 8 to 10 hairs, put it into this machine. You can see it in this diagram. The machine rotates, breaking it into very tiny pieces, and we get an extract. And then we mix it with PRP. And then with the syringe, we inject it here in multiple places at a gap of 1 centimetre. The whole process takes about 20 minutes to half an hour. Patient goes back the same day. There is no blood, there is no pain. Patient can do the work as usual. So it is definitely simple, it is easy, and because it is your own product, it is safe, and cost is roughly equal to the cost of 4 sessions of PRP. So it is pretty attractive. Now the next question is, how effective is it? See, in any medicine, any treatment gets evidence as years pass by. When the treatment is introduced early, there will be only 2, 3, 4, 5 research papers. After 5 years, it will get 30, 40 research papers. So right now it is in an early stage. It is a promising treatment with potential. I am particularly impressed with the latest paper published recently. Here is a copy of it, photo you can see. And so we are now doing it routinely in the situation that I mentioned, and we have seen some patients specifically coming and telling, sir, I don't want PRP, I find this treatment better, please do this treatment. So to summarize, this is a new treatment which is in the category of regenerative treatments. This is derived from the hair follicles from the back of the head. It's a natural treatment. It's an easy treatment, just 1 session. It can be mixed with PRP. It is suitable for those who cannot do PRP, who do not have time for PRP, or who are afraid of injections. And as we go along, we will accumulate further evidence. I hope you have liked this video. Please share it. Please give our feedbacks, and please visit our website venkatcenter.com. Thank you very much.